Good evening and good morning, dear colleagues. I'm very pleased and honored to have a chance to talk for this KU-UCI joint conference. I'm Youngmi Lee from Department of Medical Education, and I'm going to talk about the medical education adaptations during COVID-19 in South Korea and my university. And my colleague, Dr. Hyunmi Park, will address how we are developing a virtual clinical case education. Over the last few days during this joint conference, you already have had an extensive explanation on the COVID situation in South Korea. I would like to briefly address the situation related to medical education though. As you can see in this graph, the blue are the new COVID-19 cases, and the positive COVID patient rapidly increased, and the new daily case number hit over 900 on the 29th of February. The usual start of a Korean academic year is March 2nd. So as a blessing in guise, the academic year have not yet started yet, as the school could be kept shut and education was moved online. On 29th of February, the government announced the social distancing rules. In Korea, we have KAMC, which is Korean Academy of Medical Colleges, which is like double AMs in states. On February 24th, KAMC recommended delayment of starting new spring semester to the middle of March. And they recommend again the suspension of clerkship education on February 29th. So KU and other medical colleges had to stop the offline lectures and clinical clerkship from 29th of February. South Korea adopted a 3-level social distancing schema, and cities decide the level according to the daily new number positive patient. And for last semester, most of the time we were in level 2. Fortunately, we have not experienced level 3 so far. This table shows KU guideline for academic administration level 1 to 3. For last semester and so far, we have been mostly level 2. So it means we can have offline classes and offline tests if students' number is less than 50 in a classroom. So in my university, in medical school, special medical school, we have offline test at the end of the last semester, and now we also have offline test with students, less than 50 students in a classroom. In this May, KAMC asked medical school deans about medical adaptations and challenges during COVID-19 pandemic. And for this survey, out of 40 medical schools, 37 deans participated. Like other countries, preclinical courses were changed to online education, and the area of least change due to the relatively controlled COVID spread in Korea were clinical rotations and the assessment area. Clinical rotation could be started again from March 16th with average 3 weeks suspension. The majority of assessment for the preclinical and clinical years were just delayed, or some of assessment were conducted on-site under strict governmental infection prevention guidelines. Pure online assessment was only tried in 4 schools for pre-med years, and some were hybrid online on-site exam. The challenges faced were mainly due to technical and user inexperience issues and the lack of finance and human resources. This problem affected the preclinical phase the most. For the clinical students, their clerkship activities were sacrificed for their safety, which resulted in limited learning opportunity during their hospital clerkship. The teaching hospitals and clinicians had to put the treatment of the patient above their teaching commitment. However, generally, the dean's comment on changes in medical education introduced by COVID-19 were positive. We were very surprised at the overwhelming positive comments we received from the dean during these difficult times. The dean said, after the initial teething problems, there have been an increased confidence level for all stakeholders. Medical students' high acceptance of adaptability to online learning, and they applied diverse online teaching and learning methods. And so these changes promote student self-directed learning. And also, online medium was useful in supporting students who needed remedial education. Thanks to adaptation taken by COVID-19, they could reinforce the education system environment for online education. And most importantly, there was an attitudinal change toward medical education itself and online medical education. Now let's move on to Korea University again. This graph shows KU overall curriculum map. So we have 6 years, 1, 2, 3, 4, 5, 6. But first 2 years is pre-medicine course and 4 years medical course. The starting date of each semester are differently by study years. For pre-med course, usual starting date are same as other disciplines in the university. It means beginning of March and September. However, as you can see in the table, medicine starts 3 or 2 weeks earlier than other disciplines. And the core clerkship at the year 3 and year 4 electives are usually started in January. So we adapted our curriculum according to the COVID pandemic social distancing rule. So as I mentioned earlier, we have to stop all campus online campus class on late of February, and year for preclinical years, all classrooms are still continued online, and year 3, as I mentioned earlier, after 3 weeks suspension, we can sustain the hospital rotation. So most of the preclinical courses have had online, but Department of Anatomy used a blended approach during the last semester. Anatomy lecture also changed entirely online, but from the middle of May, anatomy dissection lab was held at on-campus lab. This picture shows how we prepared the student with PPI before entering the dissection room. Actually, for the last semester, our online education was mainly large group lecture, and we could not provide a small group discussion properly. However, from the second semester, which was started in September, we have used the Zoom online conference more actively than the first semester, and this picture shows small group discussions by student group with or without faculty members. As I mentioned earlier, student assessment in Korea mostly have been operated on campus with maintaining 2-meter distance and infection prevention measures. However, last week in my university, we had finally 2 positive confirmed medical students who are supposed to take examination this coming Friday. After several discussions, we decided to provide online examination to students with the cheating prevention measures. You can see in this picture. The course director provides this guideline to the student how they can prove they are free from cheating. They have to record their appearance during the online examination, like these pictures, using their own smartphone or other computer device. However, at this point, we should deliberately consider online examination and potential teaching behavior. You may have heard of open book test in the UK. Some of medical educators in Korea also like this approach. However, this type of online examination has not yet widely accepted, especially by students. The reason why the most of medical colleges in Korea still use a grading system instead of pass and fail in student assessment. So most of the students are very sensitive and nervous of their grading and do not trust that online examination is credible. In my medical school now, seriously consider the change of student assessment system to criterion reference instead of a ROM reference grading system. And also we are trying to apply portfolio evaluation system as a step to develop a basis of programmatic assessment. From this November, as you can see in this graph, we are midst of a third wave. Daily new cases are over 300, unfortunately. But we are still under 31,000 cumulative cases. In summary, so far, disruption in medical education in South Korea unfortunately is not so serious like states in Europe in terms of sustaining clerkship and having safe offline examination. However, we never know what will happen tomorrow and the day after tomorrow. The Dr. Uli Croft suggests that when the pandemic has subsided, the world of academic medicine will have changed. So he suggested the virtual clinical learning will be expanded during the new normal era. Korea and my university will not be an exception. So now we are preparing to virtual learning platform which can enhance students' self-directed learning and individual tailored learning, whatever pandemic exists or not. My colleague Dr. Park will address what we have been doing for developing virtual clinical learning platform. Thank you for your attention.